Hi everybody, this is the planet Earth here. Today I'm going to be showing you how bad anxiety can be. Type in YouTube. What do you see? You see videos. Why do you see these videos? Because panic attacks. Because of anxiety. Because of happiness. Because of sadness. Because of stress. Because of drama. This is why you see YouTube videos. People want to express themselves. But what happens when all you do on YouTube is type in panic attack? What do you see there? You see panic attack on live television. You see a 15-year-old has stress-induced panic attack from looking after 9 siblings. What a panic attack feels like. Extreme panic attack caught on video. Dealing with anxiety and panic attacks. Paige has a panic attack. What causes a panic attack? And dealing with anxiety attacks. And you call my friend here, JD32199NS, has extreme panic attack captured on video. Panic attack. Leah has a panic attack. My first panic attack. Rhonda has a panic attack. Doctor explains how to stop a panic attack. Panic attacks scary videos, what a panic attack feels like. Kendall has a panic attack. And I filmed my anxiety panic attack live, which got 1.8 million views because he's a popular YouTuber. Now, what do we all have in common? We have a panic attack. What is a panic attack, you may ask? A sudden feeling of acute and disabling anxiety. Let me show you a picture of a cliff. I'll give this an example again. What does this cliff show? What does it mean when you're near a cliff? This is just an example taken off the internet. What do you see there? You see a man jumping. What is he doing? He's jumping in excitement. How far down is that cliff? It looks like it could be 1,000 feet. Could be 800 feet to 1,000 feet down. Now, what is that feeling of adrenaline? I didn't spell that right. Okay, adrenaline is a hormone secreted by the adrenal glands, especially in conditions of stress, increasing rates of blood circulation, breathing, and carbohydrate metabolism, and preparing muscles for exertion. Alright, the hormone epinephrine, extracted from animals or prepared synthetically for medicinal purposes. So, what is adrenaline? Adrenaline, epinephrine pen, epinephrine pen. Yeah, I spelled that right. Epinephrine pen. I don't know how to say that. I apologize. But just to give an example, people who have anxiety disorder should not be taking epinephrine pens, because if you take an EpiPen, epinephrine pen, you could have a massive panic attack. Massive panic attack. Think about this. Let's take a picture of an EpiPen. EpiPen. If you inject this into your body, if you inject an EpiPen into your body, the first thing that's going to happen is your heart rate's going to increase. So, in other words, what I'm trying to get at here, and I'm trying to end the story here, is the EpiPen, right? This EpiPen here, this EpiPen, right? This is a panic attack without the actual need for the adrenaline itself. However, you would still need that if you're having an anaphylactic reaction. In other words, you have an allergic reaction. Anaphylactic reaction. That is a panic attack in a box. Okay? Let me put it to you this way. Getting injected by an EpiPen is the exact equivalent of having a massive panic attack. What happens during an sudden adrenaline release? Vital signs. Vital signs. Vital signs. What are the vital signs? Let me show you what the vital signs are during an EpiPen injection, or aka a panic attack. So, EpiPen injection, vital signs, panic attack, caught on video, blood pressure. Let me give you an example. My video should be coming up. Here it is. I'll give you an example. I have a panic attack, right? So, what is the heart rate during a panic attack? What is the blood pressure that can be as high as it can be during a massive panic attack? Adrenaline is released. You will shake. You will shake violently. Now, imagine having this problem without the EpiPen. Just every day, you're casually la 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 la. You know, you're just casual, right? You're casually doing things. And then all of a sudden, you have a panic attack. For no reason. Literally no reason whatsoever. You have a violent and massive panic attack where you start shaking violently for no reason. An example of an EpiPen injection is the same thing. So EpiPens are a panic attack in boxes, but they will also save your life during a anaphylactic reaction. But just in general, I'm trying to give you a medical term of what the symptoms might feel like. It's the exact same feelings that an EpiPen shot would give you. In other words, your body is doing the EpiPen thing. Now look how fast my pulse is on this video when I recorded it back in 2K14. Look at the pulse right here. It's 100, or it's loading right here. And just to give you an example of how high the pulse went and blood pressure went. This was during a massive panic attack. This was at the peak of one. This is the same thing adrenaline might cause. Especially if you get an EpiPen injection temporarily, of course. But obviously it'll help you save your body. And there it is. So, almost a hypertensive emergency. 173 on the top, 105 for the diastolic, pulse of about 130 beats per minute. So, what does an EpiPen do? EpiPen does the same thing. It increases your heart rate, increases your blood rate. It allows your body to react to a deadly situation, which is a anaphylactic shock, by releasing the adrenaline. It causes your body to react and take down the swelling in a reaction, if you have an allergic reaction. That is the kind of shit that you'll need in emergency situations, what Benadryl can't help with. So they give you the EpiPen. You don't want to go on an anaphylactic shot. So 173 over 105. Now, this is what happens during a panic attack. When somebody's having a panic attack, I'll give you an example. This video, I recorded when I was having a panic attack. Now, the pulse wasn't really high, but I was still panicking. An example of how high the blood pressure went. (137 over 109). The diastolic was extremely high. Pulse was 106. Now, that's just an example of an adrenaline release on the body. So, what is responsible for the adrenaline release? Well, adrenaline release. Tumor. Can be because of a tumor. Okay. Okay, so adrenal glands. The adrenal gland is what causes panic attacks. Okay, this is what causes panic attacks in the first place. So if your adrenaline glands are overreactive, or your thyroid is, your adrenal glands are going to overreact. Now, you think you're dying during a panic attack because your body is reacting as if it actually is dying. That's what happens. This is exactly what happens, and it's not fair to people, but it happens. So an EpiPen is a panic attack in a box. They should just call it panic attack in a box. Will save your life, though. That's what it should be. But, like I said, once you get injected with the EpiPen, that same thing will happen with your blood pressure temporarily. So if you have high blood pressure and they give you the EpiPen, they hope they give you a beta blocker to go with it. But your pulse rate will go really, 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 really fast. You'll feel flushed and you'll feel like you're going to die. But at the same time, it'll save your life. It's weird. It's a kind of a catch-22. But at the same time, I have been trying to teach people what it could feel like if you're having a panic attack. I don't really know how to show it to you guys. I don't really know how to show it to y'all. I don't know how to show it to y'all. But the panic attacks are extreme. And they really are extreme. Let me give you an example of another panic attack that I had. This was another panic attack that I recorded while I was in a shower in California. Let me show you the pulse rate. It wasn't that bad, but it was 147 beats per minute. And I'm just standing there in the shower, crying because I thought I was going to die. And I didn't want to call EMS anymore because I already called them multiple times. But 147 pulse. That's just an example. And then another video that I recorded was another panic attack. And I was shaking violently. And I had to get injected with the Ativan. And it did calm me down. when they injected me with the Ativan, I did calm down eventually. Because what happens is the Ativan, it seems to help calm down the GABA receptors and the overfiring of the brain, which of course was released by adrenaline. Adrenaline is the biggest bitch. So what do beta blockers do? Beta blockers block adrenaline. So in an emergency situation, like, that's why beta blockers are used to block adrenaline, because it blocks the hormone from being released as much. Now, of course, in a real emergency situation, I really don't think a beta blocker is really going to block too much of that. If you're actually having an actual emergency, I think the body will react whether or not you have the beta blocker in your system. It'll block the effects of a beta blocker. Now, when he injected me with the Ativan and then flushed me in my system, I mean, look how red I was. I was all fucked up. I was having multiple panic attacks, and I was shaking violently, and just stupid shit like this. And then I was doing fine this day when I recorded it. And the funniest thing is, though, I don't really know how to explain it to you, but I was fine that day and then I had this panic attack. After I had this panic attack, it lasted for a couple of hours. They actually kept me at the business after they closed because they wanted to keep an eye on me. Now, they kept checking my blood pressure after this video, and I was shaking, and I thought I was going to die there in that medical office. I really thought I was going to die in there. That's what it feels like. It feels like you're going to die. It really does. It just feels like you're dead. That's it. It's over. You're done. You're done diddly dead. And it's not fun. It really is not. It's just not fun, guys. I really don't know how to explain it to people. The terror from it. The terror from having these panic attacks and going through them for so long. It's like, just like this comment says right here from Trevor Francis. I live a nightmare that haunts you. The worst part is when you wake, you relive the nightmare. And people that don't have anxiety disorder, they don't have depression, and they don't seem to have any type of problems with their brain and or body, they don't know what a panic attack is. And the Anxiety and Depression Association of America, this is what they give out, okay? It's the palpitations, pounding heart, or accelerated heart rate, sweating, trembling or shaking, sensations of shortness of breath or smothering, you're being choked, feelings of choking, chest pain or discomfort, you get the nausea or abdominal distress, feeling dizzy, unsteady, lightheaded or faint, chills or heat sensations, numbness or tingling sensations, and derealization, feelings of unreality, being attached from oneself, fear of losing control or going crazy, and fear of dying. When you are having a panic attack, nothing goes through your brain other than I'm going to die. I'm going to die. I'm going to die. I'm going to die. That's what goes through my brain. We aren't thinking of it's going to be good. It's going to be okay. Pause the video. Okay, now, we have, during a panic attack, we don't think it's going to be okay. It's going to be alright. Everything is fine. Nothing during an attack will stop us from thinking of the worst. Nothing can stop us until the brain stops releasing the hormone into the system. The blood, until adrenaline is stopped from releasing and our heart rate has come down. During an attack of panic or anxiety, they are very similar. You cannot think clearly. I don't know how else to explain it to the people who do not suffer from it. Think of someone holding a gun at your head with it cocked backwards, ready to go. That's the same rush someone will feel during an attack of panic. And it doesn't go away on its own. Never tell anyone or anyone to stop panicking. Stop the panic attack. It will not go away on its own. There's nothing to stop it other than benzos. Benzos will stop it within 20 minutes. It helps the body relax. That's why benzos are abused. That's why benzos are abused. That's why doctors do not prescribe benzos for more than a few weeks. However, people with very bad anxiety disorders or brain disorders, which causes a lot of adrenaline to be released for really no reason, will abuse benzos. Abuse of benzos is because they are trying not to have the terrible anxiety disorder that we have. That's why benzos are abused. That's why they work. They work because they do stop the panic attack. They tell the body, it's okay, time to relax. Okay, chemicals, you can stop releasing all that adrenaline. That's why during an attack and after, you shake, because your body is releasing adrenaline like it's the end of the world or a tiger is attacking you and you need to run for your life, when in fact nothing is happening to you. That's why millions of people are scared of the thought of having another attack. That's why people abuse benzos. That's why EMS is called. Some vital signs during an attack can be extreme for temp reasons. Example, my blood pressure during an attack was as high as 205/137. That was technically, I don't know how to spell technically a hypertensive emergency. However, it wasn't. Within 20 minutes of an IV administration of Ativan 4 milligram injection, my blood pressure was taken every 5 minutes. 205. It started at 205/137. Machine was beeping violently. Okay, I will say at 10 p.m. is when it was that high. 10:05 p.m. It was 190/110. At 10:10, it was 160/110. 1:07. And then at 10:15, it took 20 minutes to bring down that blood pressure pretty well. And then as soon as the pulse slowed down, that's when everything really started to lower. At 10:15, it was 158 over 102. And then at 10:20 about, it was 140 over 99. And about 10:30, about 10 minutes later, it went down to 130 over 89. And then after about an hour later, it went down to about 127 over 85. And then after 2 hours, it was normal. 2 hours after IV administration, it went down to 115 over 78. That is, the pulse rate. The pulse rate was high. It was at 66 beats per minute. Yeah, it was definitely at 160 beats per minute, and then it dropped down to about 130. But then as soon as the Ativan kicked in, it went down about 100. And then it dropped down to the 80s. And then after about an hour, it dropped down to the 70s because the adrenaline was still in the bodies. And then 2 hours later, it was in the 60s at normal blood pressure. That was technically considered a hypertensive emergency, which is the theoretical hypertensive emergency, obviously, is anything over 180 on the top, which is systolic, over 120 or diastolic on the bottom. If it's temp, you're okay, aka panic attack, adrenaline release. So if anything over 180 over 120, or if you got like 150 over 120 or 160 over, you need to go to the hospital because your diastolic is too high. Anything over 180 and you haven't had that before, you need to go to the hospital because that's too high. So during an adrenaline release, your blood pressure can be extreme. If you have low blood pressure, you might have normal blood pressure during a panic attack. If you have high blood pressure, you're definitely going to need to be going to the hospital, especially if you don't have any Ativan to take. But the 4 milligram injection of Ativan is kind of a lot. Made me sleepy and knocked me out within about 30 minutes. I mean, I was knocked out sleeping. The 2 milligram won't knock me out, but you give me an injection of 4 milligrams and I'll be 9-9. So, after that, it never spiked up again that high. I guess your body acclimates. It adjusts to the dangerously high blood pressure. Now, you won't stroke out with it temporary that high, but it was high. So, I mean, I was hitting over, like I said, 200 on top, 205 over 137. So, just think about that for a second, how high that is. Not the dangerously, that's not the highest, but that is high. So, 4 milligram injection of Ativan and fluids, IV fluids, aka saline solution, helped a lot. So, 4 milligram injection of Ativan, it made me sleepy, knocked me out. And I usually take about 2 or 3 milligrams a day. It depends on my mood. It depends if I'm going out. If I'm going out, I'll take another Ativan. If I'm not, I won't. But I'm not taking as much as I used to. So that's good. So, panic attack. Panic attack. It tells you right here at the 80AA. Right there. Your palpitations, your skipped heart rates, pounding heart, fast. You're sweating. And I do sweat during a panic attack. Trembling, I'll get that. It depends on how bad the panic attack. If it's a mild one or moderate, I don't shake. If it's an extreme one, and I'm having a hard time breathing, yes. You could get short of breath because what happens is, you want to get technical of why you get shortness of breath, is because your muscles tighten up, and that includes your chest muscles. So if your chest muscles shoot up, you might have a hard time breathing, but your body will let you breathe. You just won't feel like it is. So you're going to panic, and then it's going to make it worse. Especially, the worst one, more than the sweating, the palpitations, or the accelerated heart rate, is having the short of breath. That one right there, and these two right here are going to make people super uncomfortable and call 911 or your local EMS or emergency room. These three right here I think are the worst. Feeling dizzy is okay, but when you start getting... Okay, these four right here, these are the worst ones. Numbness or tingling sensations. These ones aren't too bad. I get the tingling, but I don't get the numbness sometimes. But the sensation of shortness of breath, the feelings of the choking, the chest pain or discomfort will cause people to go to the ER room. Fear of losing control or going crazy. I do have that occasionally with a panic attack. And since many of the symptoms of the panic disorders mimic those of heart disease, thyroid problems, breathing disorders, and other illnesses, people with panic disorders often make many visits to the emergency rooms, convinced they have a life-threatening issue. In the past, it might have taken months or years and a lot of frustration before getting a proper diagnosis. Some people are afraid or embarrassed to tell anyone, including their doctor alone, about what they experience or fear, or seen as a hypochondriac. Now, that is the one thing that hurts me the most. Yes, we're hypochondriacs because of our panic attacks. If we didn't have them, we wouldn't be hypochondriacs. Many people suffering from panic don't know they have a real and highly treatable disorder. So, in the end, keep defending yourself if you have panic disorder. Don't let people tell you otherwise. It's a serious illness. And I'm going to call it as an illness. Because that's what it is. Thank you guys for watching. This has been the Planet Earth here.